welcome back to the Meta Precision Health Podcast, where I dive into research and then dissect it into very easily actionable steps for you to do straight away at home to optimize your health, extend your longevity, and prevent health-related issues with a functional medicine, a root cause approach. Now, today's topic is on iron and something called ferritin, which is the main iron storage protein. And the reason I want to talk about it is because it's a very common blood marker that most people have had tested. And people often know that if iron is low, it's linked to feeling pretty shitty, like low energy levels, fatigued, having issues with performance. Athletes, for example, often test for their iron levels. But often people aren't aware that high iron levels are actually also equally problematic, in particular when it comes to longevity. And I want to talk a little bit more about what the symptoms are and what the health-related issues are when it comes to both low and high iron levels today, and what the actual optimal range is. Because as always, if you've listened to me before, you know that I always go into why it is so important to look at not just the normal reference range, which is the average of the population, but actually see whether you are in the optimal range where things function optimally in the body and you're not already starting to kind of create some sludge and things not working just because you're in the normal range but not where it should be to function perfectly. Now, ferritin, that iron storage protein, is a perfect example because actually the normal reference range, depending on the lab, can be somewhere between 10 and 300, depending if you're a woman or a man. Sometimes it can be 20 to 300 or 20 to 150, but that's a pretty big range. Now, research suggests that for optimal health and for your blood cells to get enough iron, and you're actually needing iron to produce red blood cells and transport oxygen to your cells, which is then used for pretty much everything in the body. It's needed to make thyroid hormones. It's needed to create neurotransmitters such as dopamine and serotonin in the brain. So it's important for brain health, mood, mental health, preventing depression, but also just helping your whole body overall energy levels and not feeling so tired. Now, other symptoms commonly linked to low iron and low ferritin that are commonly missed are factors like having problem sleeping, restless legs at night. But they've also found that kids, in particular with ADHD, that have a very disturbed sleep and just can't wind down, often there's an underlying iron deficiency. Now, like I said before, normal levels start anywhere between 10, 20, 30, depending on the lab, and they call that normal. But research suggests that anything below 50 can already contribute to all these symptoms I mentioned before. Your blood might not be getting enough iron to produce red blood cells and then to produce and create transport energy everywhere, give oxygen to the cells, and then everything just becomes it just doesn't function that well and the body isn't feeling good. So I see this quite commonly in my female patients in particular that are still having a cycle. So they're losing blood every month and they just don't feel right. They're feeling tired, their hair is falling out. They're maybe even really finding it struggling getting out of the bed, having dark circles under their eyes, and they go to the doctor and they test their ferritin and they say, you're fine. But then they come to me and I see their ferritin is at a 15 or at a 20, which is, as you can see, it's normal depending on the lab, but way below optimal, which is it's just a 50. They even showed that often athletes go and train at high altitude because it helps you get stronger. But they found that in order to reap that benefit, you actually need to have a ferritin, that iron storage, of at least 50. Now, for athletes, they actually sometimes even say that it might be better, and they suggest to be even higher than a 50, even towards a 60, maybe even a 70. But they used to think and there still is that kind of school of thought that for athletes in particular, that more iron is better for their performance. And while that is true in some cases, the more iron, the more exercise performance you have, because you obviously have more red blood cells and you get more oxygen to your cells. Research also shows that iron that is on the high end of the range can cause problems with long-term health, longevity. Now, it's kind of having to figure out what's your main goal. Maybe having higher iron levels for a few years while you're competing competitively might be okay, but just be aware that having iron at the high end of the normal range, and I'll talk about what that means in a second, has been shown to contribute to free radical damage. And free radical damage is that stuff that damages our cells, it damages our DNA, it causes mini mutations, and that's been linked to pretty much every ill health trajectory that we're trying to prevent as we get older, such as cancers, heart attacks, atherosclerosis, strokes, brain damage. It's been linked with Alzheimer's, for example. So we really want to make sure that we don't go and shoot up too high. And I see this very commonly with my male patients after a certain age, because iron starts to accumulate if we're not getting rid of it. And we don't really get rid of it that much unless we are a woman and we're having a monthly cycle, we're losing it through blood. And sometimes athletes actually lose a lot more because they're sweating a lot, and there can be micro traumas where we're losing some of that blood. So athletes are also often more prone to be on the low end. But for the regular Joe, if they're male or if they're a woman postmenopausal, or a woman that for whatever other reason isn't having a monthly period because they're suppressing it with the pill or anything else, they are also more prone to just starting to accumulate that iron. And then we see that ferritin starting to creep up. Now, I mentioned in the beginning, normal lab ranges say that anything between 10, 15, 20 to 150, 200, 300 is fine, depends on the lab. Research suggests that actually anything above 100 is already linked to free radical damage, and some research even linked anything above 79, so that's quite low, if you can see right bang in the middle, is linked to a higher risk of mortality when you have cancer, but also all sorts of mortality risk. So anything that you don't really want. So you're aging quicker, you're dying quicker. So anything above 79 or at least 100 is ideally not great for us. What do you want to do? So you might have your ferritin levels tested and you say, okay, it's usually an easy fix to fix low iron levels, because you can eat more iron-rich foods and you can take iron supplements. I'll get into that in a second, a little bit in more depth if you've done that and it hasn't worked. But sometimes people find it harder to figure out what to do if iron has started to accumulate. And like I said, I see it very commonly in my male patients and in women postmenopausal, because they just don't lose that blood. In particular, the ones that enjoy a little bit of meat here and there. Now, the first strategy is obviously to reduce intake, but you don't want to. I'm not a fan of cutting out meat and animal products overall, because they have other important nutrients that are harder to get from plant-based products. So I always recommend having a balanced diet. Animal products, plant-based products, lots of veggies, lots of good protein and fats, a variety of different whole foods. Now, if your iron is still high, then another strategy is to give blood. So donating blood has been shown to lower, obviously, your red blood cells, your iron stores, and it has been linked to like a reduced risk of all-cause mortality, unless you're overdoing it. So you obviously don't want to overdo it. So you want to test your iron levels once in a while, your ferritin levels in just a regular blood panel. Now, so if you do that, perfect, that's a good thing. Research suggests you can do it once a month. Now, the NHS here over in the UK, they usually only do it every 12 weeks for men and every 16 weeks for women, unless you have a genetic predisposition for it, where you have you're more prone to having higher iron levels, and then you might qualify for more frequent bloodlettings on the NHS. Now, if for whatever reason you can't donate blood, if you're either you've had a cancer or some other kind of viral infection that don't make you qualify to donate blood, or if you're too small and too light, like some small petite people might be, and then you don't qualify for it, there are options where you can do something called a therapeutic bloodletting or phlebotomy, where you draw the blood out like you would do if you're donating blood, but then sadly you just have to get rid of it or the company where you do it, they get rid of it for you. Now, If you've done that and your iron still stays high, we then like to look at why is this happening. Now, obviously, the first step would be to say, okay, do you have that genetic predisposition? Is that something that you need to be more aware of? The other factor would be that ferritin being elevated is actually an inflammatory marker. So sometimes ferritin can be elevated even if iron stores are normal, but because there's inflammation. So it's always important to check and look at it not from a bit like a bigger picture, not just look at ferritin on its own, but to also look at other factors when you look at a blood panel and at the person. But so if that's the case, then functional medicine would say, where is that coming from? Where is that inflammation coming from? Is there a chronic infection that maybe has been missed? Is there something else increasing inflammation? And then we obviously want to address that. Now, on the other hand, if you have low iron levels and you've done the basics of increasing your iron intake in your diet, so you're eating more meat, you're trying to reduce things that block iron absorption, such as coffee and tea while you're having meals, you're adding in vitamin C rich foods when you're eating iron-rich meals because that helps the absorption. So there's all these little tricks, and I'll put them all in a blog post. You can read about them if you want more information. If you've tried those tricks and you still have low iron levels, then it might mean that you're losing blood excessively, such as quite commonly women will then go on and have a look for fibroids, for example, endometriosis. Maybe they're losing too much blood. And then obviously, the normal medicine would probably say, let's give you a pill to suppress your hormones, stop your cycles. From a functional medicine perspective, we would then look at why is this happening? Why are there fibroids? Why is there endometriosis? Are there hormone imbalances? Again, are there inflammatory factors that make the body grow those things? Often there can be other factors linked to it, such as low iodine levels. So we would look into that a little bit in more depth rather than just suppressing the hormones with the pill, because then that has other side effects down the line. So we always want to just fix things so they don't have side effects somewhere else. But then you might also want to look at other factors. For example, sometimes the body just can't absorb iron well because there's a problem in the gut. Frequently that can be seen if there's for example, chronic infection of H. pylori, which messes with the stomach acid production, or people that consume a lot of acid reflux blocking medications such as omeprazole, because we actually need some of that reflux to be able to absorb iron. Now, if someone has reflux, they're taking these medications, it blocks it and we can't absorb it. Usually because the person that has to take it, there's an underlying chronic infection that makes them have that reflux. So functional medicine would just dial it back and say, okay, where is this coming from, rather than throwing in medications. I'm not ever against short-term medical normal medications if they help the person feel better and really get through a difficult patch. I don't generally recommend people just getting off things. That always has to be done in conjunction with their doctor. But at the same time, I believe, and that's a functional medicine approach, is looking at the root cause. Why is the body not absorbing it? Or why is the body storing it too much? Is there inflammation? Are there chronic infections? So that's kind of the approach that functional medicine would take. So to summarize it, I find ferritin a really good, what is called a predictive biomarker. It's a very simple blood test that you get in most of the time when you go to even your normal regular GP, they'll run a ferritin. So it's one of these markers that you hopefully have them every year, and you just want to make sure that they're in the optimal range rather than in that wide normal range, because like we said before, low levels can make you feel pretty miserable, and high normal levels can maybe make you not feel bad. You might not notice it, but they contribute to decline and reduce your longevity, reduce your health down the line. Now, I hope this was helpful. I would love to hear from you if you found this helpful, if you have questions, if there are any topics that you would like for me to explore more, and then I will try and produce content for that. Have a wonderful day and speak soon.